My name's Todd Campbell. I'm a registered pharmacist. I was recently hired over at the Missouri Ozarks Community Health Center as a floater, like a floater pharmacist between the new Mansfield location and the current Ava location. So I didn't grow up here. I'm originally from New Jersey. I went to Temple University School of Pharmacy in Philadelphia. Graduated in 1999, and I've been a pharmacist for 26 years. My first job was in 1992 in a long-term care setting. So it was a nursing home setting. I was a technician, and then I piqued my interest in going to pharmacy school in 1996, graduated in 99, and then I became a pharmacist there for several years before I moved out here. I was involved with a gardening group, oddly enough, out in Ozark County, and I was connected with some people that lived out here. I was looking to move out of New Jersey, and I connected with them, and then when I started coming out here and visiting, and I started passing through Ava, and I said, wow, Ava's a really neat little town. And then I eventually found a nice property and moved out here in 2015. 90% of our job, I've always told people this, I said, you can go to pharmacy school and you can have all this knowledge. It's 90% of your job is going to be customer service. I said, whether it's someone calls on the phone or comes in or whatever it is, you're always going to be dealing with people. I said, you can give them all the technical information that you want. I said, but they really, at the end of the day, they don't really care that much about what you know, as long as you're going to be sitting there listening to them and what it is whatever their concern is, and then you can kind of work through whatever problem that they have, and then they'll trust you that much more. We're supposed to be, we're approachable. You just walk right up to us, and if we don't know something, we'll just get back to them. We're not somebody you have to call in, leave a message on some phone line and get someone to call back. Nope, we're right there for them. And sometimes the best answer that I like to give people is, I don't know. Let me call you back because I don't know everything. And I think that's one of the reasons why a lot of people like pharmacists, is just because we have that personal connection with people. Even though a lot of people that come in here are on a lot of different medications, sometimes my focus is to say, what can we do beyond your medications in order to facilitate a better health outcome for you? I'll say I'm in my mid-50s and I do X, Y, or Z. Maybe that's something that you might want to consider as far as a better outcome rather than something else. So just giving them alternatives in addition to their prescription regimen from their physician. I really love fitness. I like training. I like cooking. I like gardening. I like working outside. So I'm very health oriented.